My name is Jennifer Modelack, and this is my video presentation for abnormal psychology. I chose to do my video presentation on borderline personality disorder. And the book that I chose for this presentation is called Siren's Dance, My Marriage to a Borderline by Anthony Walker. It's a case study. I'll grab my note here. I just started this and got my camera working. My laptop webcam wouldn't work, so this is my next option. Excuse me. Okay, so this story is basically about a man who is in med school. He's with a resident at the hospital, and he's taken in to examine a patient who was committed to the hospital the night before because she had attempted suicide by overdosing on amitriptyline, an antidepressant that she was on for her problems with borderline personality disorder. And as they were in the room talking about her as a patient, he was very drawn to her and a little bit confused because she didn't seem to be someone who was depressed. She was talkative, and she smiled, and he was very attracted to her, Anthony, who was the doctor in the story. So he was very interested in her, and it was about that time of year that he was supposed to organize a presentation and present at a conference, and he decided to use her and her story as part of his presentation. And it was through their meeting and interviewing that he actually fell in love with her. And it was against the advice of the doctors and residents of the hospital that he knew. They warned him that it probably would not be a good situation, and that it was kind of against the rules in his type of profession. But he and Michelle, what's her name, were very attracted to each other. And it was that excitement and impulsiveness of their relationship that made them so close. Her mother had actually called him and invited Anthony to go on a date with Michelle to a party that they were having with some of Michelle's parents' friends. And it was that night that they drank, and that same night that he ended up sleeping with her, and their lovemaking was just very passionate. Everything about her just seemed very elusive to him. He was very intrigued, very attracted, and it was very easy to fall in love with her. The downside was that she had borderline personality disorder, which is the disorder that I chose for my presentation. And just to give a history of Michelle and her disorder, she did grow up in a pretty good family. They were wealthy parents. A lot of the material that I've covered suggests that this disorder a lot of times comes from an upbringing that involves abuse or neglect. In her situation, there was no abuse or neglect. The author does make reference in his book, though, that he thinks it's possible her mother did suffer from borderline personality disorder, and that obviously that wasn't diagnosed, but that was just his thinking. And so the DSM does say that there is some evidence that this disorder can have genetic implications. So she did have a good upbringing. As she moved on into adolescence, she had a lot of problems with depression and anger, being aggressive. She was unable to keep a job. She was unable to keep very good relationships with people. She was violent. She tried to hurt herself. She obviously tried to commit suicide. But she was the life of the party. When she would be with her friends, she was very fun, very outgoing. She liked to do things in excess. She drank in excess. She would sometimes eat in excess and do things, spend money, and live a very exciting life. And then on the other side of it was the very dark and scary, depressing side of her illness. A DSM diagnosis gives some traits of borderline personality disorder as patterns of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation, identity disturbance, unstable self-image or sense of self. Michelle obviously did not have a lot of care for herself. She didn't feel good about herself. She was very controlling in her relationship. She didn't like Anthony to be away from her. She felt upset. She would threaten to hurt him or hurt herself if he was to leave her. And being a resident at the hospital, he was on call, and she would accuse him of being on call as a way to get away from her, an attempt to try to be away from her. And it got to a point in his life where he was unable to do simple things like go running or, just do things that normal people do. She didn't want him to be away from her. She had a lot of issues with abandonment and being alone. That's a major one of the criteria for borderline personality disorder. Also suicidal behavior, which she exhibited, instability and marked reactivity of mood. She would go from, being very excited to very upset. She would do things that were violent, like bite, hit, chase him with scissors. She threatened to kill herself. She threatened to hurt him. Their relationship was just very volatile. She would not want him to ever be away from her, and it was really taking its toll on him. And he knew better, but he was still very drawn to her. So those are some of the symptoms. And for the diagnosis for, I'm kind of backing up here a little bit, for borderline personality disorder, there are, let's see, lost track of myself here. This is for emotionally unstable. Okay, disturbances in uncertainty about self-image, aims, and internal preferences, liability to become involved in intense and unstable relationships, often leading to emotional crisis, which was obviously the case in their relationship, excessive efforts to avoid abandonment. She would do anything. She would threaten. She would hurt. She would threaten to inflict pain on herself if she was left alone. Recurrent threats or acts of self-harm. Obviously, she attempted suicide. She was in the hospital, and chronic feelings of emptiness. So any of these or all of these in this situation will lead to a diagnosis of borderline personality disorder. So I've already gone over some of the symptoms. The treatment options kind of are difficult in this situation. A lot of times they don't, with the suicide rate and the attempted suicide rate of these individuals, doctors tend to want to stay away from drug therapy just because there's such a high possibility of drug misuse or overdose. A lot of times there's substance abuse issues with these types of people, and so they try to avoid that type of therapy. One type of therapy that has been successful, I've read, is the dialectical behavioral therapy, and it's basically a therapy that helps these people with these disorders. Sometimes they are medicated, but also receive this behavioral therapy, and it helps them learn to control their emotions. It deals with obviously the problems and insecurities that they face, with themselves, but it also gets them to a point where they are in control of their emotions, and they can harness that impulsivity and really try to fix that, because it's really what destroys their relationships and keeps them from keeping a stable job or things like that. The prognosis for someone who goes through this kind of therapy is pretty good. There is, like I said, a high suicide rate, but the people who make it through the therapy and are able to follow those steps have a pretty good prognosis. And the people, studies have shown, and I read in a few different places in the manual and in our textbook, that people into their 30s and 40s tend to have increased stability and success in their relationships and in their vocation. So as they get older, the symptoms seem to decrease. It seems to be more intense and more volatile when they are in their 20s. So, but there is a fairly good prognosis for someone who does get treatment and dealing with this disorder. And my first speech was much longer than this. Hopefully this satisfies the requirements. I really was very interested in this course. I learned a lot from the different tests that we had to take. A lot of